How's the feeling when we do this?
It's not hurting.
Good. You have sensation? Good. Acupuncture is the insertion of little thin needles that most people can't feel at all. They're very thin. It causes little micro injuries on the skin surface, and it triggers a response in your body, especially your brain, to kind of want to heal that specific area. All right, to the toes we go. Basically what we try to do is kind of trick your brain into not responding with its normal pain receptors. In other ways, it also releases your body's natural opiate response. So we all have painkiller responses in our body naturally, so I just help encourage them. All right, turning up both sides. Pretty equal on both sides? Right side, you don't feel anything? Okay. Acupuncture for integrative oncology is somebody who helps with symptom management of people going through cancer or who are post-cancer survivorship. Have a good nap.
Okay.
I go through their charts before seeing what kind of cancer we have, what kind of treatments they're on, if it's post-treatment, and the symptoms they're actually dealing with, anything from even chemo-induced nausea and vomiting. That's a really big one that we deal with because patients do quit their chemotherapy treatment if they can't continue because of the nausea.
Yes.
You can feel it on the right side? Good. It's always good to have alternatives for people, especially in the same building. It's extremely important to be able to have people go through their cancer treatments with the access to these kind of things, because in the general public, you may find acupuncturists, but they may not be trained in oncology. There's a lot of contraindications, there's a lot of things that you can't do or locations you can't needle. Being the person that will help relieve symptoms for patients, anything to help them get through their treatment or post-treatment help them recover from their treatment. And of course, the relationships that I'm able to form with these patients. Thank you again.
Okay, you're welcome.
Bye-bye.
Bye-bye.
I like being a sense of relief and hope that, there is a finish line for, people going through chemotherapy treatment or symptom management.